Today we'll be looking at an interesting topic based on the current situation that we find ourselves. I'm talking about the COVID-19 pandemic, and the topic will be public health nurses' involvement in prevention and control of COVID-19 pandemic in Nigeria. Yeah, globally, the scientists and epidemiologists have said it, and they have established the fact that we are going to live with the coronavirus for some times now, meaning that we cannot shut down our economy globally for a long period of time. And that is why there are a lot of information that has been spreading around that we still have to ensure that the preventive measures and the control is maintained. And that is why I have a special guest that will do justice to the topic. And I'm talking about Nurse Jumoke OJELEYE from Department of Nursing, Lagos State University. Thank you for joining us.
Thank you. Good morning. I hope you can hear me.
Of course, and everybody can hear you clearly.
Can you hear
first
me?
of all, let me. Yes, of course. Yeah, of course. First of all, let me start with this pertinent question. We all know that healthcare providers are taking a very large impact in ensuring that this COVID-19 is being controlled and the circulation is being controlled as well, taking some other preventive measures. What are the specific roles of public health nurses in ensuring that this virus, what are the measures that are being taken in order to curtail the spread of this virus in Nigeria?
All right, thank you, Mr. Adams, for having me on your show again. Hello to all the viewers. All right, so this is a message that has been going on for at least about 6 months now, and we'll keep saying it. Like you just said, that we're still going to have the coronavirus with us for quite a long time. And so we just need to learn how to live with this virus. So I think this message is a very important one, very critical one at this time. Like, we have to keep talking about it. We can't, it's just something that would go on for a while. So the first thing I would say for a public health nurse, yes, I'm a public health nurse, though not practicing directly in that capacity at the moment, because I've gone throughout my career, I've done different things, but the knowledge and the training I have in public health is still very important to what I am doing at the moment. So the first thing for a public health nurse, one, education. As a public health nurse, you should understand that you are dealing with populations, the selfish populations. It could be children, it could be preschoolers, it could be people in daycare, it could be caregivers, it could be orphans, it could be workers in an industrial setting, dealing with teenagers, elderly. There's just a specific set of population you are working with. Sorry, can you still hear me?
Yes. Go on.
Okay, so I can hear one noise and I'm trying to be sure it's not from my end. Okay, so as a public health nurse, education is a big role that you have to play. Starting from your home, because they say charity begins at home, from your home, from your compound, from your streets. There should be somebody pushing out the message. So it means that if you are buying bread on the street or you are buying biscuits or drink, when they know you as a public health nurse, you should be that person, their go-to person, their plug when it comes to, let me ask that woman, she's going to tell me. You enter a shop, somebody wants to sell something to you and the mask is just loosely hanging. You talk about it like, wow, wear your mask properly. You are protecting yourself. Do you know how many things that you can protect? Do you know how well you can protect yourself with this virus? Have you heard of people dying from this virus? Have you heard of how our isolation centers are being filled to capacity? Things like that. So education is a big role. It's a big role for the public health nurse. Another thing is, of course, so the education can be across all these levels. You have to bring the information in a way that a child understands. So my children at home, when I wash my hands, you hear things like, "Mommy, did you wash it for 20 seconds?" I'm like, wow. So hand washing message should come to little children in a way they understand, such that my own kids are now telling me that, "Mommy, you wash it for 20 seconds." I'm like, wow. So that's a 7-year-old talking, right? So how about an adult that doesn't know that you should wash your hand for 20 seconds? And don't know saying 20 seconds, you tell them what goes into 20 seconds. So as a public health nurse, you have a big role in giving tailor-made messages to populations that you encounter. It could be market women. You know, if you sell in the market, you should have messages that market women will understand. If you're in a community of the elderly, you should have messages for elderly to help them understand their risk. Elderly people know you need to be careful. You don't go to parties at this time. You don't go to public places. In fact, it has to be essential. It has to be a matter of life and death. One elderly to show up in a function now. So I think that's education is one of the major things, and of course advocacy, just in case you have access to people who can do things, change the situation of things, you have to advocate for, okay, maybe messaging materials and what can be done, you know, to ensure that coronavirus, we limit the spread of coronavirus in our community and in the nation at large. So that's it. Thank you very much for that question.
Thank you very much for that beautiful answer. Talking about the preventive measures that the public health nurses should ensure. So, because we are all involved, and then I think I love the typical example that you gave. It starts from home. So even the kids. So whatever we practice at home is what they will have to take outside. So I think as a public health nurse, we have a big role to continue to ensure that we live in a safe environment. This will lead me to this next question, and that will be talking about the control now. How involved are public health nurses in the control of COVID-19 as well?
All right, so truth be told, even in Nigeria, the nurses have been on the front line. In fact, all categories of nurses have been at the front line. The nurses, the midwife, the public health nurse, everybody. Because it's not a virus limited to a kind of person or group of people, you know. So all forms of nurses, all categories of nurses have been, you know, are relevant at this time. And I think it's one thing about and midwives think about. It's something to be thankful for. That you are first of all in a profession that's if the low world let it be tumbling down, you will still be relevant.
Yes.
Right? And you're not just relevant, you are being paid for what you are doing. So I think it's something to even celebrate, right? You are not in one of those jobs that you can be on hold for the next 6 months or 12 months. Anyway, that's not what we are talking about. I just thought of it that way. That I think it's something to be thankful for. That's it, number one. Now, the specific measures by public health nurses. One, I'll talk about advocacy. Advocacy for what? So advocacy is like being the mouthpiece of people, right? That's what advocacy is in simple terms. Being the mouthpiece of people, asking for the right thing that these people need. So one of the things that public health nurses can be advocating for at this time is hygiene measures. Now, restrictions are being eased gradually across board. You are working in an industrial setting. You should be advocating for standard precautionary measures. Do we have enough IPC materials? Do we have enough nose masks? Do we have sanitizers? You know, all those things are very, very important as a public health nurse, because you know how people should protect themselves and how they can limit the spread of their virus. Peradventure they have it to other people in different settings, especially because restrictions are being eased across board. So one, advocating for the hygiene measures. Another thing that public health nurses, I think, we are not doing well at this time that we should, specifically focus on, just because you have that background training in public health, is that we should leverage on digital technology. You are doing a good job, Mr. Adams, with what you are doing. Leveraging digital technology to spread the news, to spread the message. Some people are on Facebook Live as we talk. Some people are going to come on Facebook Live after this show. Some people will see this show 5 years after now, And so it's just doing the right thing at the right time. And at this time, a lot of people are on digital platforms. So nurses, public health nurses, midwives across board around the front line should leverage digital technology so that they can have a wider reach and they don't have to come in contact. I don't know where you are doing this video from now. I'm just sitting in my car and we are still trying to pass the message, right? But I pass the message. Another thing we can do, apart from leveraging on digital technology, I would say is partnering with media houses. There are a lot of messages going out, but it's not about the message. We want the right message. So for me now, I am interested, or I have been pushing a lot of nurses who have platforms, who don't have platforms, to use any opportunity around them to reach the public. Because as a public health nurse, you are dealing with the public. I work with a group of teenagers. I work with undergraduates. I work with different categories of people, right? I do in different settings. So I'm trying to ensure that I'm partnering with all these platforms to ensure that the right message is passed out. That's another thing that's and collaboration is also very important, specifically as nurses. If you see somebody doing a good job already, partner, just collaborate, support, to say, okay, just for our voice to be stronger, right? Collective efforts, it will result in a stronger voice. Our message, when we say it at the same time, the world will hear us. So that's what I just think that some of the things we can do. The messaging is very important for me at this time, because I think that we are beginning to hear, strange messages and counter messages, right? And so as public health nurses, we should first of all know the right message, right? And then be also be able to share the right message. So you hear songs like, do you know somebody that has coronavirus? Do you know somebody that knows somebody that knows somebody that knows somebody that has coronavirus? I didn't understand what that song means until recently, like this week. I just said, oh, are they trying to say COVID-19 is a scam? My brother, these people have asked me, do you know anybody that has this coronavirus? And that's not a right question to ask me, because first of all, I work around the hospital, so I know people that are on bed as we speak. It's just for me to put a call, 1, 2, 3 calls through. I have people in the isolation centers telling me the different categories of people they are managing at the isolation centers. The ones that are on life support, the ones that are just needing mild care and things like that. I have people in PHCs, it's just for them to tell me what is going on at all these primary health centers. So I tell them, I say, I'm not the right person to be asking that question. I said, COVID-19 is real. But messages like it's a scam, we need to debunk it. It is not a scam.
Sorry to cut you off at this time, because that will lead me to the next question, because I have a question on that. The advice to the government, the policy makers, then talking about that people that are having the notion that the virus is scam, in quotes. This is where the policymaker have to do a lot of things to carry people along, and then just like what you said earlier, information dissemination is very, very vital. And then so that's why we have to have this question: what advices do you have for the policy makers? I'm talking about the state government, and the federal government as well.
Well, unfortunately, they have no idea in place at this time. So whether they want to do something or not, they had to come out of their comfort zones, right? So we'll keep talking to them, and we know that they will keep adjusting and keep giving, that duty of care that they have to their citizens. So specifically to the questions, the question you just asked me about the role of the policymakers, governments, I will speak again for public health nurses. Number one is that we need continuous investments.
Okay.
In our nurses, in our public health, we need continuous. Forget about the investment you made in January, thinking that we're going in this direction, but now COVID has happened, and it is affecting us badly, right? So
Yes.
we need continuous investments in our nurses. Unfortunately, we have lost a lot of them across the world. May their souls rest in peace.
Yes.
We have lost a lot of them. A lot of them have been taken off work because of this. So one of the things we will tell the policymakers and governments at this time is they need continuous investment in nurses. Governments that don't prioritize their nurses are just a joker. They are just the joker. And some of them are joking as we speak. They are joking. Because I don't know how they want to fill that vacuum. It's a vacuum if you don't have nurses in the equation. If you don't have nurses in the equation, it's a big vacuum. I don't know how it's going to be filled. So one of the things is continuous investment in public health nurses, because they already have this capacity. They have this potential in them by virtue of their training. We only need to continue to develop it, sharpen it, right? So that they are fit for this time in terms of knowledge. And I like what like WHO, the UN, and all that, national governments, state governments keep doing training. We'll tell them not to stop. Can you hear me? Are you able to hear me?
Of course. Yes.
Oh, all right.